Hello everyone, today we'll be discussing the topic of medications and their administration to special populations, namely pregnant or breastfeeding patients, pediatric patients, and geriatric patients. Because as paramedics, it's important to understand the potential risks and benefits of using medications with these patient populations. So the learning objective is to discuss special considerations in drug treatment with regard to pregnant, pediatric, and geriatric patients. Before administering any drug to a pregnant patient, it's crucial to consider the expected benefits against the possible risks to the fetus. Drug regulating agencies have established a scale to indicate the potential risks of drugs during pregnancy. The categories include A, B, C, D, and X. Category A drugs are considered safe to use during pregnancy. Category B drugs have shown no harm in animals but may not have been adequately studied in humans. Category C drugs have shown potential harm in animals but may not have been adequately studied in humans. Category D drugs have shown potential harm to the fetus in human studies. And Category X drugs have shown definite harm to the fetus in human studies and should not be used during pregnancy. However, it's important to note that many drugs are unknown to cause problems in animals and or humans during pregnancy. So it's very important before administering any medication to discuss with the patient to confirm if they are pregnant. So pregnancy causes a number of anatomical and physiologic changes that can affect how the body metabolizes and responds to drugs. Some drugs may cross the placenta and impact the developing fetus, while others may pass through lactation and affect the baby. So to minimize risk to the developing fetus, it's important to discuss any medication use with the patient's healthcare provider. Again, this is more in the context or role of more of a community paramedic before administering any medication. This also includes over-the-counter medications and supplements. It's important and actually interesting, I should say, to know that the absorption actually will change throughout the term of the pregnancy. Initially, when there's an increase in blood volume, there's actually an increased absorption of any medications given to a pregnant patient. Where we go further on into the pregnancy, where there's a lot more pressure put into the intra-abdominal cavity, that will actually decrease the absorption of a medication. So it's important as paramedics, it's our responsibility to provide best possible care to all of our patients while taking into consideration the potential risks, for example, in this scenario, to a developing fetus. There are certain medications that we have in our scope of practice, which we do not give to a patient who is pregnant or breastfeeding. And we'll learn about that once we go over the indications, contraindications to aspirin. Now, there are also key differences in pediatric pharmacology. It's important to understand that children are not just small adults when it comes to medication. Don't be surprised that if throughout the program, one of the other teachers refers to pediatric patients as aliens, because that is exactly what they are. They are not small humans. They process, excrete, and metabolize drugs differently, and this must be taken into account when administering medications to pediatric patients. Unfortunately, research on the way medications interact with pediatric patients is limited. However, it is known that the responses children have to medication are much more variable and dynamic than we have ever thought possible. Additionally, adverse reactions in children can be specific and different from adults. In pediatric pharmacology, dosing is often based on weight. Therefore, it's crucial for practitioners to understand dosage calculations. So this includes conversions such as teaspoons to milliliters or milliliters to ounces, from pounds to kilograms or kilograms to pounds, etc., etc. Here in the photo, actually, you can see the Broslow tape next to the child. So the Broslow tape is a great tool in emergency medicine. It's color-coded and it's based off of the pediatric patient's height, and it's coordinated with, in the hospitals, when you start doing stage, you'll notice in the crash cart, there's one that is for pediatrics and it's color-coded, just like you see here to the left of the pediatric patient, the different colors. And depending on the size of the patient and where they line up on that Broslow tape, essentially almost a measuring tape, that color will match an emergency pharmacological kit, which should contain the right dosages and medications for that patient. Now let's look at the four key areas in terms of pharmacology when we talk about absorption, distribution, metabolism, and excretion. Regarding absorption, it's important to know that it's more erratic in children than adults. This varies based on the child's age, such as infants, toddlers, preschoolers, and adolescents. One reason for this variability is their gastric pH, which fluctuates during different stages of development. Additionally, bile secretion and intestinal permeability can also affect absorption. For distribution, we know that children have a higher body to brain ratio, which affects the distribution of lipophilic drugs such as benzodiazepines. This is important to remember as midazolam is part of your scope of practice and is a benzo. And when we talk about lipophilic drugs, lipo meaning fat, of course, the concentration of fat in the patient's body will have an impact on these drugs. And in terms of metabolism, it's important to note that children have higher metabolic rate and a different enzyme profile than adults. So this can quickly affect how quickly drugs are metabolized and eliminated. Finally, for excretion, it's important to understand that the renal clearance and elimination of drugs can be different in children. This may affect the dosing of drugs that are eliminated through the kidneys. Again, children are not just small adults, and the way they process, excrete, and metabolize drugs is different. Therefore, it's important to consider these key differences in pediatric pharmacology when we are administering our medications. It's important that we are aware of their unique consideration and adjust our practices accordingly. Now let's discuss geriatric patients or geriatric pharmacology and how aging affects medication administration for the elderly. As we now know, after discussing pediatrics, pharmacology is not a one-size-fits-all, and geriatric patients require special considerations as well. The process of pharmacokinetics, which includes absorption, distribution, metabolism, and excretion, are affected by aging. Starting with absorption, the process of the drug moving from the site of administration into the bloodstream, changes in gastric emptying time, small bowel surface area, and gastric pH. All those things can have an effect on the drug absorption in the elderly. In most cases, the absorption of drugs is not significantly different in the elderly. However, there are certain medications such as levodopa, that's specific for Parkinson's, and digoxin can be affected by decreased gastric emptying and decreased active transport. This all can have an effect of the absorption of vitamins and electrolytes. Additionally, the transdermal route, so through the skin, transdermal route may be beneficial for the elderly as it offers a steady rate of administration, ease of use, and circumvents hepatic first-pass metabolism. In terms of distribution, the transfer of the drug from the bloodstream to the tissues is affected by changes in the total body water and body fat. As mentioned before in pediatrics, lipophilic drugs, so drugs that are attracted to water and fat, may have an increased half-life when body fat is higher, leading to increased levels and prolonged effects of these types of medications. Distribution is also affected by the presence or absence of plasma proteins like serum albumin. As we age or are malnourished, serum albumin decreases, leading to changes in the binding of some medications such as warfarin, which is the anticoagulant, and phenytoin. This can lead to higher levels of unbound drugs, increasing the risk of side effects. In terms of metabolism, the process of breaking down drugs in the body, changes in liver and renal function will have an effect how drugs are metabolized and eliminated. This is especially true in the elderly. Age-related changes in enzyme activity can also lead to prolonged effects of drugs, especially those that are metabolized by the liver. So imagine the liver not functioning as effectively when somebody's young and healthy. Well, the medication that should be metabolized quickly will not be metabolized as quickly and can have a longer impact, a longer effect on that patient. In terms of excretion, the process of eliminating drugs from the body, changes in kidney function can lead to decreased elimination of drugs and an increased risk of side effects. Additionally, some medications such as anticholinergics and sedatives can cause confusion and delirium in the elderly, increasing the risk of adverse reactions. It's important to note that older adults often have multiple chronic health conditions and take multiple medication, increasing the risk of side effects and drug interactions. Therefore, as paramedics, it's important to review the patient's medical history and be familiar with common drug interactions and side effects in older adults. Again, in our scope of practice, pharmacologically speaking, we do have inclusions and exclusion criteria, and some of those exclusion criteria are specific to interactions with other medications. So I'm thinking in terms of the context of nitroglycerin, so if the patient is on any PDE5 inhibitors or taking any medications for pulmonary hypertension. But again, we will go through that once we get to our medications. Now, when you will be faced with older adult patients, it's important for you to consider the changes in absorption, distribution, metabolism, and excretion that we just talked about, specifically how those are changed with aging. And we need to adjust or at least be cognizant of how giving a medication can be different or has to be modified for these patients, specifically talking about dosages. So that concludes this lecture in discussion on the special considerations in pharmacology for special patient populations, and we will move on to the problem-based learning activity.